Hello and welcome. In this video, we are going to talk about the prevention of cervical cancer in women and HPV vaccination. To understand HPV vaccination, we will discuss some information about this virus. There are at least 13 types of human papilloma virus linked to cancer of the cervix, the anus, vagina, penis, mouth, and throat. These cases are in men and women. Most cases of human papilloma virus related cancer are caused by just two types of high risk human papilloma virus, type 16 and type 18. When does this virus cause cancer? The immune system fights most human papilloma virus infections and clears them from the body, usually within 2 years. But sometimes the virus can last longer as an infection. A longer infection with a high-risk human papilloma virus type can turn into cancer. This usually takes years to happen. It can take 3 to 7 years for certain changes in the cells of the cervix to become cancer. Cervical cancer screening will detect these changes while they are still easily treated. If there is severe or moderate changes on cervical smear, the abnormal cells can be removed from the cervix. The HPV vaccine may be given to help with treatment in some cases. If there are mild changes, pap smear is repeated to see if the cells go back to normal. The HPV vaccine is a safe and effective way to protect against the human papilloma virus infection and its related diseases. It is highly effective if it is given to a person before the person has started sexual activity. The vaccine can reduce the risk of the HPV-related genital warts and cancer by up to 99% when all recommended doses have been given. Millions of people around the world have been given the HPV vaccine without any serious side effects. Countries such as the United States, Australia, Canada, the United Kingdom, and many European countries have established HPV vaccination programs. These programs are also present in Asia, Africa, and Latin America. The vaccine does not contain live virus, so it cannot cause an HPV infection. The vaccination works best when it is given before a person is sexually active and exposed to HPV. But vaccination can still reduce the risk of getting HPV for people who have already been sexually active. The ideal age for HPV vaccination of girls and boys is 11 or 12. But anyone can get it starting at age 9 and through age 26. If a person is older than 26 and has not been vaccinated and is at risk of a new HPV infection, the doctor can discuss if there is a need for HPV vaccine. The vaccine is approved for people through till the age of 45. How is the HPV vaccine administered? Between the ages of 9 to 14, 2 doses of vaccine are recommended. The second dose or injection should be given 6 to 12 months after the first one. For those between the ages of 15 through 26, 3 doses of vaccine are recommended. The second dose should be given 1 to 2 months after the first one, and the third should be given 6 months after the first one. The 3-dose schedule is also recommended for anyone from age 27 through till age 45 who decides to start the vaccine series after the prescription of the doctor. What happens if a child misses a dose of the vaccine? Children who have missed a vaccine dose do not have to start over. The child can get the next dose that is due even if the time between them is longer than recommended. This is also true for adults, and if an adult has not completed the number of recommended doses, they can continue with the program for completing the required number of doses. The side effects of the HPV vaccine. After years and years of experience, it has been seen that the most common side effect of the HPV vaccine is soreness and redness at the site of the injection. There are no reports of severe side effects or bad reactions to the vaccine. If a person is married and infected with one or more types of HPV, they can still get the HPV vaccine because the vaccine may still protect against other HPV types. Here, Gardasil 9 would be prescribed. Will a female still require cervical cancer screening after having HPV vaccine? Yes, she will still need to have cervical cancer screening. The doctor will inform her about the frequency of pap smear screening. What does cervical cancer screening involve? Cervical cancer screening includes the pap smear test, an HPV test, or both. Both tests are using cells taken from the cervix. In the pap test, we can detect abnormal changes in cells of the cervix. If testing shows cell changes that could lead to cancer, the treatment can be given before cancer develops. In the HPV test, this can identify most of the cancer-causing types of HPV even before there are visible changes in the cervical cells. Screening should start at age 21. The frequency of the screening will depend upon age of the woman and her health history. In addition to HPV vaccine, how else can a person protect themselves against human papillomavirus infection? Although the vaccine protects against the most common causes of genital warts and cancer, it does not protect against all HPV types. So a sexually active person is advised to use a condom or a barrier method every time they have vaginal, anal, or oral sex. This can help reduce the risk of HPV infection. How can the HPV vaccine help with treatment after HPV infection? Human papillomavirus infection can lead to changes in the cells of the cervix, and these changes are called cervical intraepithelial neoplasia or cervical dysplasia. When CIN is moderate or severe, known as CIN 2 or 3, treatment involves removing or destroying the abnormal cells. The HPV vaccine may help prevent abnormal cells from coming back after the patient has been provided treatment. How can the HPV vaccine help with treatment after HPV infection? A woman can get the HPV vaccine to help with treatment for CIN if the following applies: getting treatment for moderate or severe CIN, which is CIN 2 or 3, from the age of 27 to 45, if a woman has not previously gotten the HPV vaccine, the immune system is normal and healthy. Anyone aged 9 to 26 should get the HPV vaccine as usually recommended, regardless of whether they are getting treatment for CIN. There are three types of HPV vaccine available globally. These are Cervarix, Gardasil 4, and Gardasil 9. All of these are approved by the FDA. Cervarix vaccine is effective against HPV type 16 and 18. These types cause 70% cases of cervical cancer. These types are also causing most HPV-induced genital, head and neck cancer. There is some cross-reactive protection against strains 45 and 31. Since 2016, Cervarix is no longer available in the United States. However, Cervarix is still available in China, Europe, the Netherlands, and UK. Gardasil 4 was launched in 2006 and protects against the sexually transmitted strains of HPV 6, 11, 18, and 16. HPV 16 and 18 are responsible for 70% of cervical cancer and are also responsible for HPV-induced anal, vulvar, vaginal, and penile cancer. HPV type 6 and 11 are also responsible for 90% of genital wart cases. This vaccine is given in 2 doses, the first dose and the second dose after 6 to 12 months. It is recommended to start this vaccine at age 9. Gardasil 9 was approved in the United States of America in 2014. This is a vaccine which is effective against the human papilloma virus strains 6, 11, 16, 18, and as well as 5 other strains 31, 33, 45, 52, and 58. This vaccine is given in 3 doses. The first dose and the second dose after 2 months and the third dose after 4 months. It is recommended the vaccination starts at age 9. Human papilloma virus vaccination programs are existing in many countries of the world. South of Africa, sub-Saharan African countries, some Asian countries, Latin America, United States of America, European countries, the United Kingdom, and Australia. Countries where there are successful human papillomavirus vaccination programs include the following. The United States of America, where children from the age of 11 to 12 years are recommended to get the vaccine, 2 doses of vaccine 6 to 12 months apart. HPV vaccines are normally given at age 9. Children who start the vaccine series on or after their 15th birthday need 3 doses given over 6 months. In Australia, between the ages of 12 to 25 years, you can receive an HPV vaccine for free under the National Immunization Program. For those who are 26 or older, they need to have a Medicare card if they want the vaccine. The United Kingdom is again one of those countries where the vaccination program is running very successfully. It is offered to all children between the ages of 11 and 13 and is also available to people up to the age of 25 who have missed their vaccination when offered, men who have sex with men, and some transgender people. In Europe, only girls are vaccinated, and HPV vaccination is free of charge but voluntary and not included in the national mandatory immunization schedule as part of the National Program for Primary Prophylaxis of Cervical Cancer 2021 to 2024. In those countries where successful HPV vaccination programs have been implemented and are currently running, it has been seen that the incidence of cervical cancer is slowly decreasing. And in addition, women are also getting an advantage from the obstetric point of view in terms of a lower risk of preterm labor. So in summary, we can say that cervical cancer in women is preventable by two methods. The first method is vaccinating boys and girls starting age 9. The second method of prevention is that women still need to have pap smears and HPV screening if it is available according to national protocols to ensure low risk cases of cancers in women. HPV vaccination of boys and men is necessary because it not only reduces the risk of cancer of the oropharynx and penis in men, but it also decreases the risk of transmission of the virus to the women. With this, we come to the end of the video. Thank you for listening to the video. And if you like it, please subscribe, press the like button, share it with friends and colleagues, give comments, and press the bell icon so that you can be notified of future videos. Thank you and goodbye.